Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. We'll be speaking with Alan Comer in this segment, Senior Director Research at Mallinckrodt. He's joining us here to talk about recent advancements made in burn care and why there should be a move past autografting for deep partial thickness burns. He's also going to talk a bit about a cutting-edge treatment now available that supports the body's own ability to heal and gets replaced by the patient's own cells over time. Patients should consult their healthcare practitioners to learn whether or not it's appropriate for them, and visit www.stratagraft.com for important safety information and full prescribing information. Welcome to Health Professional Radio. Alan Comer, thank you for joining us.
Hi, good morning. Glad to be with you. Thank you.
A bit about yourself briefly, if you would.
So I'm the Senior Director of Research at Mallinckrodt Pharmaceuticals, and in that role, I lead the company's research and development efforts for its pipeline products, including StrataGraft. I also serve as the principal investigator on the Biomedical Advanced Research and Development Authority, or BARDA, contract. I began with the technology in 2000, and I've been involved in a number of areas, including research and development, quality control, and clinical development. Mm-hmm. At Mallinckrodt, our primary focus is to build a pipeline that addresses unmet patient needs and medical innovation, as well as to expand indication with our current products.
And who is your current patient population base?
So we treat several conditions at Mallinckrodt. In addition to patients with severe burns, which is the target population for StrataGraft, our focus is in autoimmune and rare diseases in areas like neurology, rheumatology. We also treat hepatology, pulmonology, and a number of other critical care conditions.
We said that we were going to talk about some of the recent advancements made in burn treatment. What do you think is one of the most challenging aspects of burn care?
So over the past few years, there have been a decrease in or increases in survival among burn patients, but there really have been limited advancements in treatment of the wound itself and promoting wound closure without the need to do an autograft. StrataGraft was approved in June 2021. It's an allogeneic cellularized construct that's indicated for the treatment of adults with severe burns that contain intact dermal elements and for which surgical intervention is clinically indicated. Those are also called deep partial thickness burns. Many times, deep partial thickness burns are treated with autograft, which is the surgical harvest of a sheet of skin, uninjured skin from the burn patient, and transplantation to the burn injury. While that is an effective treatment, it comes at the cost of creating a painful donor site wound where the autograft was harvested. And that is an extremely painful wound and is also subject to potential infection, cosmetic impairment, and other issues. So we are really looking to try to reduce the reliance on autograft for the treatment of deep partial thickness burns.
Is rejection of one's own skin ever an issue under these circumstances with such a severe burn?
That would be a very rare event, rejection. There can be graft failure due to a number of issues, but rejection would not typically be an issue.
Now, as far as StrataGraft, are we talking artificial skin, basically?
It is a cultured skin construct that is grown in the laboratory using human keratinocytes and human fibroblasts embedded in a collagen-rich matrix. So it is a living, it has the living skin cells in it, and it is cryopreserved at the end of manufacturing to preserve the viability of those tissues. It's not the patient's own cells, and so it does not permanently engraft. It provides a sustained source of wound healing factors to help the patients heal their own burn wound with their own cells.
Okay, so it kind of provides a foundation for the patient's own cells to build on?
Exactly. It provides an immediate cover to the burn wound, and then it stimulates proliferation and healing by the patient's own cells.
As far as cytokines are concerned, it's my understanding that they're involved burn repair and injury repair in general. Is that correct?
Yeah, there are a number of wound healing factors, cytokines, and growth factors that have been shown to promote burn wound repair as well as other wounds. And StrataGraft produces a wide variety of these types of wound healing factors.
Is that wide variety of offerings what makes StrataGraft unique?
There are no other products of this type approved for burns. The other burn treatments really rely on harvesting the patient's own cells and reapplication of those autologous cells.
So talk a bit about the procedure.
So this is really part, or it interfaces well with the standard practice of burn care. So that involves the initial diagnosis of the wound to the appropriate depth, excision of the burned tissue, and then instead of harvesting a sheet of autograft tissue from the patient, physicians are able to just thaw and prepare StrataGraft and then apply it to that excised burn wound as they would for an autograft. So there's burns really come in a variety of depths, from superficial burns to full-thickness injury. Full-thickness burns really do, at this point, require an autograft. You have to have a source of autologous cells to heal that wound. In our case, StrataGraft is approved for use in deep partial thickness burns, which are severe enough that they often are treated with an autograft, but there are remnant populations of keratinocytes and fibroblasts in that burn wound that have the ability to repopulate the wound with StrataGraft treatment.
Is there anything that you'd like to add for our listeners, and then give us a website where we can learn more?
So what I'd like to really highlight is we are extremely excited to have had the opportunity to bring StrataGraft through development and into approval so that it is available as an option for the treatment of patients with these severe burns. For more information on StrataGraft, you can go to www.stratagraft.com.
Alan, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio. Hopefully you'll return and give us some updates.
My pleasure. Good to talk to you. Thank you
as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Alan Comer. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. And be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.